Hello and welcome to the introduction of our diabetes risk analysis system. To start with, the user can ask a question about the patient from the AI assistant or enter a patient ID here. On the left-hand side, the patient health record or the variables are demonstrated for each variable, the patient value, as well as the minimum and maximum values of the patients across the data set, as well as the distribution graph in the background are shown. Uh, for certain factors, BMI, glucose, and insulin, it's indicated whether the patient value lies in the normal range or a warning or critical threshold. For example, whether it's the patient condition is pre-diabetic or diabetic. In the middle, the risk assessment of the patient is visualized uh, is predicted as high risk with a 90% probability. And in the analysis visualization part, basically the visualized explanations of the risk assessment are provided. Here, the contribution of each factor towards or against the risk assessment is shown. Glucose is the most important factor with 32% influence or contribution towards the assessment. And the user can also ask from the AI assistant, for example, about why this patient has been flagged as high risk, and the AI assistant provides textual information about that. An important feature of the system is that the user can ask scientific evidences behind the importance of each factor in diabetes diagnosis, and the system provides information, direct quote in this case, from the reference, reputable reference. The next analysis is about a more in-depth informational analysis of the most important factors determined in the previous step, glucose and BMI. Basically provides AI observed ranges and scientific ranges. For more in detail explanation, user can click on the help buttons. Basically, AI observed ranges are from the AI assessments, and the scientific ranges are extracted from the medical papers or guidelines. The overlapping between these two ranges shows us that the AI predictions or assessment is in line with the scientific ranges or guidelines. Same as before, a user can ask about scientific evidences behind those ranges. For example, for normal range, uh, the scientific or the research evidence is provided and the reference. Also, user can ask follow-up questions, suggested questions that can be selected from. The next visualization is about our recommendation system that basically provides a personalized health improvement plan on reducing the risk, on reducing the predicted risk in a step-by-step manner. For each step, the system provides the difficulty level, whether it's challenging or moderate, to reduce reduce the risk for that step, and provides a possibility that the user can ask more in detail recommendations on how, or more detailed recommendations on how they can reduce their risk. And the system provides them with the like exact actions, and in a time and with a timeline they can implement or apply those recommendations to reduce their risk. Thank you very much for your attention.